student. Today we will discuss about salivary secretion is hypertonic or hypotonic or isotonic and why. Saliva is produced by three pairs of salivary glands like the parotid glands, submandibular glands and the sublingual gland. So here we can see this is the parotid gland, and this is below the mandible we have the submandibular gland, and below the tongue we have the sublingual glands, and all these glands they drain into the oral cavity. Now if we look into the structure of these salivary glands, we will see that these glands consist of blind end pieces. They are known as acini, and these acini they produce the primary secretions that contains the organic constituents dissolved in a fluid, and that is essentially identical in its composition to plasma. That means when at the level of acini the secretion is generated or secreted, it is isotonic with plasma. So when the saliva is secreted from the acini, it is isotonic with the plasma. Now, while it flows through the ducts, there will be some modification of the composition of the saliva. So we can say the composition of the saliva will be modified as it flows from the acini out into the ducts that eventually coalesce and enter or deliver the saliva into the mouth. Now what type of modification will happen? First thing is that these ducts are impermeable to water. So water content will not be changed. The sodium and chloride will be reabsorbed, and additionally there will be secretion of some potassium and bicarbonate. So these are the two things that will happen. Sodium and chloride will be reabsorbed, potassium and bicarbonate will be secreted. There will be no change in the water content. Okay. So as the water content is unchanged, but the most of the solute portion is reabsorbed, so it is easily understandable that at the end of the acini, when it is the saliva is released into the mouth cavity, it is hypotonic in nature because it has less solute and more water. So this is the normal phenomena. Other than that, the certain important factor that affects the composition or the modification of saliva is flow rate of the saliva. That we will discuss in my next slide. In this picture, it is more clearly visible that when the saliva is secreted at the level of acini, we can see that sodium chloride and water and all these are secreted and it is isotonic in nature. But while it is passing through the duct, so the sodium and chloride it is absorbed, potassium and bicarbonate is added, and the water content remains unchanged. So at the end of the acini, it will become hypotonic. But another important factor, as I already told you, that will affect the constituent of saliva is the flow rate of the saliva. This flow rate is very important. Why? Now, flow of the saliva through the salivary duct, it can be slow movement of the saliva or it can be the fast movement of the saliva. So there may be two types of flow rate. One is the slow rate, another is the fast rate of movement of the saliva through the salivary duct. At the low flow rate, particularly during the low secretion rate or flow rate, this phenomena is true. That is when the saliva will move along the duct, so at the end of the duct it will become hypotonic. But if the flow rate increases, as the rate of secretion increases, what will happen? there is less time for NaCl to be extracted from the saliva. So the flow rate is so high that the sodium chloride will not get adequate time to be reabsorbed totally or mostly into the cells. Okay, so the sodium chloride will get less time to be extracted. As a result of that, the hypotonicity will be reduced. So tonicity of the saliva, it will be raised. It will be raised. So as the rate of secretion increases, there is less time of sodium chloride to be extracted and the tonicity of the saliva, it will be raised. But although the flow rate is increased and the hypotonic saliva, their tonicity is raised, but it is always stays somewhat hypotonic in respect to plasma. So in this way we can say that the saliva that is secreted, it is hypotonic in character. Thank you. The reference is Cannon's Review of Physiology, page number 447, 25th edition.